sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show. We got a great program for you tonight. We're going to talk a little bit about Diabetes Awareness Month and how diabetes can affect the foot, the diabetic foot. And later in the program, very timely, we have the FAU Football Owls team physician on the program. But before we get started, because I know you're not going to turn away, we have an action-packed program. I just want to welcome you again. It's the You and Your Doctor show. It's sponsored by All County Healthcare, a Medicare certified home health agency. If you have any questions about Medicare or home health, or who's qualified to be a Medicare certified agency, All County Healthcare Incorporated has your answers. You can call them and ask for Maddie if you have any questions. The number is 1-888-717-7170 or allcountyhealthcare.com. And we'll talk a little bit about All County a little bit later in the program as we welcome the second doctor in. But first I want to start out, like we said, we're going to talk a little bit about diabetic foot. So November is Diabetic Awareness Month. So that's not just, diabetes affecting the endocrine system. That's also, it can affect the vascular system. So I wanted to bring on the expert podiatrist and foot and ankle surgeon, Dr. Mark Warren. Dr. Warren, welcome to the program. How are you doing tonight?
I'm doing great, David. Thanks for having me on your show.
Thank you. And you are the medical director of podiatry at Delray Medical Center, which is a great hospital right around the corner. You actually started that program?
I started the program. I helped the administration start the program about 18 years ago, I believe, already. Yeah.
Wow, it's fantastic.
Yeah.
We've had podiatrists and foot and ankle surgeons who are in that program at Delray Medical Center on the air. We were just talking. Even one of your colleagues, Dr. Ira Spinner, has been on before. So that's
wonderful.
Great job with that. And why is more than ever is the need for a podiatry and a wound clinic needed? I know that diabetes, it seems to be on the rise a little bit. Is it the baby boomer population? Have you seen that?
Diabetes is on a huge increase in the United States. If you ever go to lectures about diabetes, the population of diabetics is exponentially increasing. It has a lot to do with the economy and the diet that people are on, and fast foods and not eating the right foods and so forth. So what happens is you get diabetes, and it can definitely affect your feet tremendously. So in the clinic, we have all kinds of patients with different types of wounds, but quite a bit of diabetic patients that develop what we call diabetic foot ulcers, diabetic neuropathy, diabetic vascular problems, and they're all very serious problems. They're not to be taken lightly at all.
And those all kind of fall under that umbrella of diabetic foot that we kind of started on, that broad term. It's kind of been coined in the media lately.
Yeah.
So why is wound care important? What'll happen if that foot ulcer isn't treated, or that diabetic foot ailment? What can happen to an individual?
Well, if you look back in history and you go way back, okay, when in the ancient days when someone got a cut or a wound, what they did was they put clay on it or mud, and they put little sticks and stems on it, and their antibiotic of choice back then was honey from the bees. So over a period of time, this has progressed to a whole new world, a whole new level of scientific knowledge based on healing wounds. And the whole function of our wound clinic at Delray Hospital is to help someone that gets a wound, whether it's minor or a major problem, heal quickly with fewer complications. And the most important thing is to prevent amputation. Because in the past, about 40 years ago, if you had an infection in your foot or in your leg, you most likely were going to end up with an amputation of your leg. Now, we have seen a major decrease in the number of amputations. I think last week I heard from the hospital that they did a study, and there's about 60% fewer amputations now than there were just a few years ago at our facility.
Oh, that's great to hear.
The clinic's an asset to the whole community right now. Yeah,
it sure is, and you have a great community hospital there, and a great new facelift on that hospital. I drove by it the other day.
Yeah,
it looks like a whole different hospital. Yeah, it's like a $90 million renovation. It's got a trauma helicopter pad on the roof now. The 5th floor. Beautiful parking garage. So much easier to get in and out of.
To me, it looks like an art museum, and it's so beautiful. It's not even a hospital-looking building.
They did a great job.
Gorgeous.
I don't know who did the architecture with that, but they should win awards.
And the patient gets the most beautiful room. They end up in a private room with a big TV, and some of the rooms even are waterfront views, and they're all brand new and spotless, and your families, I believe, are welcome to stay there overnight and so forth.
Oh, that's nice.
It's a whole new concept.
Yeah.
All private rooms now. All private.
They're really thinking about everything with that.
They
I mean, they did a great
into
job.
Yeah.
So you said you've been there 19 years with this program? 19 years?
I've been at Delray Medical Center. I started there in 1985.
Oh, before that? Okay.
And we didn't have a wound clinic. We had a small hospital. We had about 80 beds. Now there's about 700 beds. We had a little hospital with about 100 doctors, and now I think there's about 700 doctors.
Wow.
So I saw a need for a wound clinic, and I asked the administration, could we do something like this here? And it was right about many years ago they started the heart programs there. They were starting new programs, and they were interested in new programs. So fortunately, we started this clinic with 4 doctors. It was myself, another podiatrist, 2 plastic surgeons, and now I think we have 9 physicians just working in the wound clinic.
Unbelievable
Monday
how
through
that's
Friday.
grown. And is it one of the reasons that it's so important to treat wounds on the foot because it can be a gateway to infection, to entering the body? I guess would that be from just getting infected from walking around, maybe not even walking outside or anything, just getting bacteria into the wound and I guess entering the bloodstream and moving upwards? Is that how?
Anything's possible. If you get a break in your skin, even if it's a little paper cut, you could get an infection. And some of the wounds, if you're young and healthy, most of the time your wound's going to heal in about 5 days, 7 days, 10 days. But in the population we have in our community, which is elderly people, a lot of them are diabetic or they have vascular disease or immunosuppressed, and they're prone to getting infected. So if that wound gets infected, it's got to be treated immediately, hopefully before you have to go in an emergency room. So we now have most of the primary care physicians referring patients to the wound clinic. If they spot a problem, patient self-referral. Most of the walk-in clinics that are 24-hour walk-in clinics in our area ask the patient to go to the wound clinic after they've been seen for their initial visit, and we take over. So the wounds, I don't know, I can't give you a percentage of how many get infected, but it's quite a bit. It's quite a bit.
That's great to know that the area is working with you. Like you said, the urgent cares and everything know about that you're in the community. Well, you've started this program a while back.
Yeah.
Why is it that the diabetic foot breaks down, or it gets kind of like inflamed more? It kind of the skin breaks more. Is there a reason because of that?
There's a couple reasons, and one is when you get diabetes, you usually over a period of time will get what's called small vessel disease, and the small vessels are the little capillaries and little arterioles that are in your fingertips and in your toes and your feet and your hands. They're the small blood vessels, and with diabetics, those smaller blood vessels don't get enough blood flow, and they become ischemic. They become areas that don't have enough blood flow to heal properly. So that's one reason diabetics don't heal as quick as the non-diabetic population. And the other one is a lot of times a diabetic patient will get neuropathy. And neuropathy causes lack of feeling in your feet, and if you don't have feeling, sometimes you don't even know if you stepped on a nail or something. And if that nail's in there, and it could be in there for a couple days and no one realizes it until they finally take a look and see some blood on their sock or some problem, and then they have a full-blown infection.
Oh, wow.
So, and then we have nutrition control, because nutrition is very important in your whole body. It affects your feet tremendously. And so mostly vascular problems, neurological problems, prone to getting infections, and lack of feeling. I remember one year I had gone in to see a patient who was in a coma, and he was a diabetic, and he had a paper clip in his heel.
Oh, no.
And it had been there, I don't know how long. We don't even know how long. And I went and took him in the operating room. I took it out of his heel, and he got better. He healed up, but he was in a coma from this.
Oh,
very,
wow.
very serious.
Just walking around the house, probably fell off his desk and got embedded into his heel.
Yeah, it was
That
there
tough
for quite a
skin.
bit, yeah.
And he just wasn't feeling it because he had no feeling down there.
No
anymore.
feeling, yeah. Yeah,
Unbelievable.
so we always ask the people with diabetes, take a look at your feet every day. Take your shoe and your sock off and take a look at your foot every day. If you see anything going on there, let your doctor know. Don't try to mess with it yourself.
That is a good piece of advice. I've actually started that in my own life. When I put on my socks in the morning, I always tell my doctor if I see anything. Everyone knows I'm kind of a bigger guy, we're watching me, but
some people can't see the bottom of their feet, so the stores sell mirrors.
Oh, yeah.
Yeah, they got little mirrors, and if you can't reach your foot, they got brushes, and they have applicators with handles on it to put medicines and so forth.
Think it out, right?
Yeah, there's a lot out there to help a diabetic patient.
Do you ever see a case of gangrene come in here
Yes,
and there?
we get that, yeah. That's because this is it. This is the full-blown major worst problem that will come into the wound clinic. And it requires immediate hospitalization. And fortunately, we all work together as a team. We know the infectious disease doctors, we know the vascular doctors, the internists, and we all work together to get this person to heal. So gangrene is usually lack of circulation. In fact, I had a gentleman in today who lost his big toe because of that. He's better now. He's doing okay.
Oh, good to
He had
hear.
surgery, lost his toe, but he's walking, and he was doing quite well right now. He almost lost his life.
And definitely. And that has a lot to do also with kind of knowing something's wrong and kind of not doing something about it. And over time, it just gets worse when you should have got into the hospital or primary care even.
Somewhere.
That can be, referred or pushed into the hospital, pushed up. Now, peripheral arterial disease, does that also contribute to the diabetic foot? Because that's something that I didn't know about until a few years ago myself, and all of a sudden it's like a keyword. PAD is the acronym.
It's huge.
It is?
It's huge,
Okay.
Most of the time, if you have any type of heart disease, most likely you've got peripheral vascular disease.
Okay.
And it goes undetected. It just goes undetected because it never becomes... You don't get symptomatic until you get like cramps in your legs when you're sleeping at night or cramps in your legs when you're walking. And it's later on in your lifetime that you get these problems, but that's the original signal that something's wrong, And at that point in time, it's time to get a check by a specialist because you can get blocked arteries. You get hardening of the arteries. It's not that hard to get hardening of the arteries. And it can be a congenital problem or your diet or whatever. But now it's amazing. We have robotic surgery available at Delray Hospital to open up these blood vessels again and restore the blood flow. And if you can restore the blood flow, you can heal the foot, and you can go home with all your toes and your foot and your leg, and you don't need an amputation. So that's the goal of the entire wound clinic.
Robotic surgery, that is something that I don't think many of us were talking about in the last few years, but now it's at your community hospital right there in Delray Beach. Dr. Warren, hold that thought. We're going to take a quick break. On the other side, I want to ask you a little bit about foot fractures because we're in football season and hear about a lot of them on the TV on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hard to believe, but we're back on the You and Your Doctor show. We have Dr. Mark Warren. If you have any questions about the diabetic foot and just anything with podiatry, you have a little bit more time, 1-888-565-1470. Dr. Warren, we really talked a lot about the diabetic foot, but like I said, I'm flipping the channels, and in basketball and football, I see foot fractures all the time, but I know that's not the only time they're happening. Weekend warriors, as people get older, they get osteoporosis.
Right, yes.
Maybe they bang into that dresser walking through the, I'm sure you've seen that a few times.
That's not
some
unusual.
bent toes, right?
Yeah.
So let me ask you a little bit about... Is surgery always? Let's start with foot fractures. So I'm thinking the metatarsals. Is surgery always needed, or sometimes are there other options?
Not always. Fractures really have to be analyzed before you know what to do.
Okay.
So most of those fractures, you're right. Someone got up in the middle of the night, go to the bathroom, stubbed their toe on the bedpost, and now they broke their little toe and maybe their fourth toe. I had a lady last week. She came in the office. She was at Disney World, and she took a wrong step, and she thought she broke her toe. It actually got crooked, and she took her fingers and reset it straight. And by the time she came in my office, she had healed herself. It was amazing.
High pain tolerance there.
So if a fracture happens and it's in good alignment on an X-ray or an MRI or whatever image you wish to take, you don't need to operate on it, okay? You can immobilize it. We have special shoes for little toe fractures, metatarsal fractures. Metatarsals are the long bones in your foot. And if there's a displacement or a malalignment, then it would require some type of surgical procedure to fix it, to fixate it, and hold it in place while it heals, and you still need the immobilization. So most of the toe fractures, they usually don't need surgery. The metatarsal fractures depends upon the degree of the damage, the dislocation. But when you get into the heel and you get in the ankle bone, it's different. Those usually need some type of surgery. The heel is almost like an eggshell, and when it cracks and breaks, it breaks into multiple fragments.
Oh, and that's not good,
and
right?
you really want to put those pieces back together then, and you have to fixate them. There's screws that go inside a foot and plates. There's external fixating frames, and there's all different methods to do this. But I'd say most of the common fractures don't need surgery, and the smaller ones. Just if they're displaced, they have to be.
Do you ever prescribe this electric pulse stimulation sometimes?
It's actually called a bone stimulator.
That's what
Dave.
it is.
Yeah, it's a bone stimulator.
I butchered that.
Yeah, bring it back. So
reverse, rewind. Do you ever prescribe those?
Not usually.
Okay.
Yeah, and if you need a bone stimulator, this is an insurance. Some insurance companies are real strict on using them. So I think you have to have a fracture for over 3 or 4 months that hasn't healed. And most fractures heal in 6 to 8 weeks.
Oh, so that's a slow
So if they go
fracture.
beyond long-term healing, then you can use a bone growth stimulator. And sometimes they look at an insurance company, look at an individual case and say, yeah, you need it, we'll do it. So not very often, but they're wonderful. The electrical current does help the bone heal a lot faster. Yeah.
Huh.
it's a real benefit to
I
fracture
figured
healing.
there'd been some research tied to the back end of that or something,
Yeah.
else doctors would not be prescribing
Yeah.
them. So I just thought I'd ask you.
Yeah, I think our most common fractures that I see in my practice are the toes, and then there's one called a Jones fracture, which is the little bump on the outside of your foot. On the outer side of your foot, you have a bump there, and that's the fifth metatarsal base. And you could break that by twisting the foot the wrong way. It can break with a severe ankle sprain. And there's a little tendon that attaches there. And if that tendon pulls in an abnormal position, it can pull the tendon off the bone and cause a fracture too. That's called an avulsion fracture. So
Ouch.
but most of these Jones fractures or avulsion fractures, if you immobilize them, they heal. Sometimes they need surgery, which would be a bone screw.
And that's that Jones surgery we hear about a lot of out in football and basketball?
Yeah, that's the one.
So, okay, yeah, I've seen a lot.
I think Jones was a surgeon back in early 1900s. So this is
Englishman, I want to say?
probably, I guess, yeah.
I remember looking it up one time because I do a lot of sports writing, as you know, and it's like, why is everyone getting, it's like the Tommy John of foot surgery all of a sudden. Like all the sports guys are getting it.
Yeah.
You mentioned something very interesting. You talked a little bit about the heel, and then you kind of went up a little bit. Do foot and ankle surgeons also treat Achilles tendon injuries? Do you go up the leg?
Yeah.
How high do you go up the leg?
Well, in the state of Florida, we are allowed to treat anything that happens from below your knee. There's a little bump on the upper part of your leg that's called the tubercle of the tibia.
Okay, yeah.
And you can feel it. If you look for it, it's right underneath your knee. It's where your tendon attaches.
Okay.
So from that point to your toes is the jurisdiction of a podiatrist in the state of Florida. So if you broke your leg, we could fix that. If you broke your ankle, if you tore your Achilles,
That's a bigger area than I thought.
That's a lot. There's a lot of coverage. There's a lot of work that we.
So you've
do.
seen a few Achilles ruptures?
Oh yes.
That looks like a painful injury.
Yeah, I've even seen them ulcerate. Yeah. With open wounds from lack of blood flow and so forth.
Oh.
Yeah.
Do you ever see them from Weekend Warrior kind of
and
not just sports?
Usually it's a tear from some kind of overuse. I mean, it can happen in tennis.
Oh, okay.
It can happen in running.
It's just not a freak accident. Sometimes overuse, it's just getting wear and tear, and it just tears.
Sometimes it just tears.
Ulcerates, like you said, in older people, right?
Yeah,
Wow,
Yeah.
I did not know that.
Yeah.
I'm glad we got you
They're
here.
real quick. They're spontaneous. They don't tear slow. They go boom.
Recovery on that.
Remember Achilles?
Oh, yeah. He went down.
He went down fast.
Yeah, he did.
Yeah.
Long recovery time on those?
It's another 4 to 6 weeks, but some of them have to be repaired with sutures, and some of them can be just put into a cast. Depends on the patient and how well they'll heal and so forth, and the degree of the injury.
Wow, I'm glad we got that because I didn't know that. What causes the ankle to sprain? Is the ligament kind of like a rubber band being stretched too far, or is it something else?
It's almost just like that, really.
Okay, just stretching the ligament too far. In some cases, breaking the ligament.
So in your ankle, you have on the outer side of the ankle, you have 3 ligaments, and they all start at that bone called the fibula, which is the outer ankle bone. So one goes forward, one goes backwards, and one goes straight down. They have names, but it doesn't matter right now. So if you tear one of those ligaments, you can pull them and they won't tear. It's a strain. Or you can go so far, like a rubber band will snap, and then you got a tear, okay? Ligament tear. So like they grade them in different stages. So stage 1, you tore one of these. Stage 2, you tore 2. Stage 3, you tore all 3. Once you tear all 3, your ankle can now dislocate and shift, and that's a lateral ankle sprain. Now, the other side of the ankle, the medial side, has one big ligament called the deltoid, and if that tears, they usually need to be repaired surgically.
And that's a surgically repaired.
Yes,
oh, wow.
That's true. Yes.
Now, do you nowadays, being the medical director and all of the podiatry department, do you spend most of the time in the hospital, or do you have a practice as well?
I have 50% of my time working at Delray's Wound Clinic, and the other 50% in an office. My office is in Boynton Beach.
Oh, nice. I live in Boynton Beach.
I have a good day. You know, I go from one to the other, and then every day I'll usually get a call to go see a patient in the hospital. So stop in, the wound clinic is on the grounds of the hospital.
Okay.
And I tell you, it's wonderful because everything I need is there to treat a patient.
Nice.
The whole thing is to get someone better.
It's a true clinic.
There's a great reward in helping someone get better. And anything I need to do that is at Delray Medical Center.
Nice.
Yeah.
Helping patients get back their quality of life.
Yeah, they basically provide us with just about everything we need.
Nice. That's good. Sounds like you have a great connection network right there at Delray Medical Center.
It's wonderful there.
It's a great hospital. And let's go back a second to your office. So I saw online BoyntonBeachPodiatrist.com.
That's my,
you,
yes,
your website, a lot of information there. And you're at 1325 South Congress Avenue, Suite 108.
Right.
Boynton.
Yeah.
So that's that Congress Avenue corridor. That's a really neat area, Boynton. A lot going on over there.
There's a lot going on. I think 10 years ago, there were cows grazing across the street.
That land, now it's like
now
the strip.
It's all filled up.
Boynton Strip is like Congress Avenue. I live in Boynton. I know this.
Yeah, I'm right on Woolbright and Congress, almost on the
I'm
corner
Woolbright
there.
and Seacrest. The water tower's in my backyard.
Yeah, I know the water tower.
Now. So I get a Bright Line train, the water tower lighted, and then FEC trains.
Yeah,
but I'll take
get
it.
all the trains.
0.6 of a mile from the ocean. I can't complain.
I call your water tower the Big Martini.
Yep. You must be a fisherman, but offshore they like to use it as a landmark.
Yeah, I'll bet. Right? Yeah.
They say, go 3 miles off the Martini glass, and there's a little reef there. You get some grouper. No, I don't know for sure.
Yeah.
Maybe we can have fishermen call in and let us know.
Let us know, yes.
Yeah, so great website there. Oh, let me give out your number, people listening, 561-369-3300. You can talk to Dr. Warren and his staff, and you can find out on the website there, BoyntonBeachPodiatrist.com, all the ailments he treats. I mean, we can't even get into all of them tonight. I'm going to have you on again. But one of them I wanted to ask about is, I've heard in the news, and I'll probably get this wrong, plantar fasciitis. What is that, and how is that treated?
There's a lot of that out there.
Really?
A plantar fasciitis is a strain of a long ligament that's in your arch. And that ligament is running from the heel into the ball of the foot. It's almost the whole width of the foot and pretty much the length of the foot. So its weakest point of attachment's in the heel. And with the wrong movement or with overuse, it'll tear. And it'll pull, it'll flame. So you get it's called the plantar fascia, and the problem is called plantar fasciitis or inflammation of the plantar fascia.
Okay.
And every day someone comes in with this lately.
Painful.
Painful.
Annoying.
Hurts like hell when you take the first step getting out of bed in the morning.
Ooh.
You're like hopping to the bathroom.
Oh no.
When someone tells me that, I almost know what's wrong with them,
Mm-hmm.
So, but it's treatable. We do a lot of good things, and you don't always have to have any surgery for that, but it's pretty treatable with just conservative podiatric care.
We only have a minute here, but we're going to go the speed round. You treat hammer toes.
Hammer toes we treat.
Bunions.
Yes, sir.
Corns.
Yes, sir.
Calluses.
Yep.
Why'd you become a podiatrist?
I am one of 8 podiatrists in my family. Yes.
Really?
We should be in the Guinness Book of Records.
Let's get you in there.
Yeah.
We're going to get that Boca newspaper. You hear that? We're going to do a story. Delray newspaper. No, really.
No,
right on the side
I'm from Michigan, and there's 7 others between Michigan and Ohio in my family that are podiatrists. And I just followed my cousins around one day, and when I was in college, and figured out, this is for me, I'll do this.
Where in Michigan are you from?
North of Detroit, a little town north of Detroit, yeah.
My father-in-law is from Grand Rapids.
Mm-hmm. Yeah.
Neat.
Yeah.
What are your hobbies and passions outside of medicine?
Well, I have a wife that's a yoga teacher, so we do a lot of yoga.
Lovely wife.
Yeah.
Met her in the green room there.
She's great.
She's awesome.
I love riding my bicycle. I'm a sailor, a fisherman.
See, I knew the martini glass is a landmark.
I love swimming laps. I love going swimming.
Yeah, you seem to keep in good shape.
Yeah, I try to stay in shape with swimming. It's my favorite thing to do. And just enjoying life and hanging out. I heard your sons
are very successful.
Yeah,
so
yes.
that's
I
good
got
to hear.
2 good boys. I'm very lucky, and grandchildren, too.
Nice.
Yeah.
Well, let's have you on again.
Okay.
This is a great conversation. We got to keep going on. I'll look for another awareness month tying into the foot, and we can continue
Sounds
this
good.
conversation on the You and Your Doctor show. Stay tuned. We have Dr. Alan Saperstein coming on the air. Right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We're back.
From traffic, I thought it was.
Yeah, South Florida, the traffic is
I always
cranking around, and we're back on the You and Your Doctor show here on Tuesday. We're here every Tuesday, 6 to 7, bringing you great physicians on the program, kind of taking you on an adventure of health, because healthcare is moving so fast, the technologies. And before I go any farther with our next guest, a great orthopedic surgeon, sports medicine specialist, and team physician for the FAU Owls, who have won 6 in a row. I'll do that a few times. They're 7-3. I just want to thank All County Healthcare for sponsoring this show. Again, we're here every Tuesday, 6 to 7. We're here on 5:30 on Fridays. That's 95.3 FM, 1470 AM. We're live streaming on All County Healthcare's Facebook page. And if you have any questions about Medicare or the home healthcare business, and All County Healthcare is the heart of their business. Patients are the heart of their business. You can call Maddie at 1-888-717-7170. And lastly, allcountyhealthcare.com. Great website there. Dr. Saperstein, welcome to the program. Thank you so much for making it out tonight.
Oh, thank you for having me. It's a pleasure to be here.
Definitely. I have a long history with FAU, and we'll go into that, but I want to talk a little bit about, you're a specialist in what we've had a few doctors on before, but arthroscopic surgery. So we hear that term as, the kind of the general public, and what actually is arthroscopic surgery?
So, arthroscopic surgery is a surgical technique. It's a type of surgery. Just backing up a second, I'm an orthopedic surgeon,
Okay.
which is one type of sports medicine specialist. There are sports medicine specialists who do medical treatment of athletes, do conditioning of athletes, take care of the heart and lungs. I'm an orthopedic surgeon, so I address musculoskeletal injuries in athletes. And the way I address those injuries is through a combination of things. Some injuries are addressed with conservative management, like stretching programs, strengthening programs, injections, medications, and some things are treated surgically. So arthroscopic surgery is a type of surgery. It's a minimally invasive form of surgery that's performed through tiny little porthole incisions in a joint that allow us to see inside the joint with a fiber optic camera and then fix things in the joint using microscopic instruments.
And those joints that can be treated, that is the shoulder, knee, hip.
Yeah, so arthroscopic surgery started in the 70s and was initially all about the knee. And still the knee is probably the most popular joint for arthroscopic surgery. But then it progressed into the shoulder and then later the hip, the elbow, the ankle. And there's virtually no joint in the body that arthroscopic surgery couldn't be applied to. But again, still the knee, the shoulder, the hip are the most popular joints for arthroscopic surgery.
And how is, I know you explained a little bit about it, but how is the arthroscopy performed? Is you go through an incision, and then also take us to a little bit, like how long would I know when you're in there you see different things and maybe you have a little more work to do than others, but how long does, let's start with a knee, how long would that surgery take?
So it really depends what you're trying to accomplish. Now that knee arthroscopy is truly mature, we could do a lot of different operations. Early operations, you could just go take a look around, make a diagnosis, maybe clean a little bit of tissue that's torn, and we still sometimes do things like that, but nowadays we do more complex reconstructions. We can reconstruct ligaments in a knee, like the ACL, the anterior cruciate ligament, very commonly injured ligament in the knee that we can reconstruct arthroscopically. That surgery is about an hour, hour and a quarter type surgery, but it really varies depending on what you're trying to accomplish. Now we can do surgeries where we repair cartilage tissue, meniscal tissue in the knee. We are doing surgeries where we can resurface the joint, where we can regrow the articular surface or the joint surface of the knee, and we can do much, if not all of that, arthroscopically as well. So we've really advanced in what we can do. Now, that's not to say everything can be done arthroscopically. There's still a role for open surgery. Things like knee replacement surgery is still done through an open incision, but we can accomplish a lot through this minimally invasive approach.
And now with the rotator cuff, and also I actually had a rotator cuff injury before, and I actually didn't have to have surgery. It was managed like you started out the program talking about. So that's a great option too, where I had a sports medicine specialist manage it. A piece of I want to say cartilage got stuck into the ball and socket there.
Sure.
And then it was just off of a fall during playing football. So, but if that injury is kind of too bad of an ailment, that there's a rotator cuff or a repair that can be done arthroscopically, and then the difference, there's something to add on to that is labral repair is a little different. Yeah.
So. Thinking back to when I trained, I did my orthopedic residency about 25 years ago, and we had shoulder arthroscopy then, and we did address rotator cuff tears with the arthroscope. We would put the arthroscope in the shoulder, we'd look around, we'd confirm that there was a tear. We would shave some of the bone and some of the bursa over the rotator cuff to create more room, but then we'd have to make an incision to repair the rotator cuff. About 15 years ago, that transitioned into a completely arthroscopic procedure. So nowadays we look inside arthroscopically, we find the tear, we shave the bone, we clean the bursa, and then we're actually able to repair the rotator cuff tissue. Rotator cuff's a tendon, so we have to, typically when the rotator cuff tears, it pulls off the bone and it leaves a defect. What we do is we pull the tissue back where it belongs on the bone, and we put little anchors into the bone that have stitches that come out of them, and we pass those stitches through the rotator cuff tissue and tie knots that secures the rotator cuff in place. And it's gotten to the point after doing it arthroscopically for 15 years, I'm not sure that I still would ever want to do it open again. I think it's more difficult to do it open. I don't think the results were as good, and I think the patients struggled much more post-operatively when we did it open. So it's really been a major transition, and that's one that I've seen during the course of my career. I've seen it really change dramatically. That's fascinating. And then when you're doing it arthroscopically, you see everything on the screen, because you said there's a fiber optic camera there. Yeah, it's you really the resolution of this camera and of the screens that we're watching on is excellent. So really, I think you see better when you do a procedure arthroscopically than when you open up a joint and you're looking at it directly. I mean, you see well, the lighting in the OR is good, but there's nothing like being able to magnify it and see it on the screen. Honestly, I mean, I think it's probably easier to do arthroscopic surgery than open surgery these days. Well, thanks for explaining that, because luckily I haven't had arthroscopic surgery, but I've always, wanted to kind of get the definition from a surgeon, to know about it. If you have any questions, we still have some time. 1-888-565-1470. We're here with
Dr. Saperstein. He's an orthopedic surgeon and sports medicine specialist. One more arthroscopic question.
Sure.
Is it performed in the hospital or at an outpatient clinic, arthroscopic surgery?
So it could be either. I would say
Oh, really?
more often than not, arthroscopic surgery is outpatient surgery, center surgery.
Oh, I thought it would have been the opposite. That's good to hear.
No. And most of the cases when they are done in a hospital setting, it's on an outpatient basis. And there are a few rare exceptions, but orthopedics is moving more and more away from an inpatient setting, more towards an outpatient setting. So we do almost everything outpatient nowadays.
Now, do you have an outpatient clinic?
I am on the staff at 2 outpatient surgery centers,
wow.
the Boca Raton Outpatient Surgery and Laser Center on Glades Road, and Surgicare of Boca, which is on Clintmore Road, both in Boca Raton, both excellent facilities.
Nice. And then you're on staff right around the corner here?
Yeah, at Boca Raton Regional Hospital. And, we talked about arthroscopic surgery and outpatient surgery, but I still do open procedures, mostly joint replacement procedures, hip and knee replacement surgeries, and most of those are done on an inpatient basis, although there's a little bit of a movement lately to try to move those to an outpatient basis, mostly on younger and healthier patients. But those I do at Boca Raton Regional Hospital.
And as the listeners have heard me on the program, with doctors, they really study each case is different. So that's something you consult with the patient about. So, it could be an open surgery, it could be arthroscopic, but that's something that you kind of work out over time with evaluations and whatnot. So that's good to know. Now, you mentioned the ACL, and I think we all kind of know what the acronym means, but what actually is the ACL and what does it do? Because it's always in the news. It's always a key word, and I don't think we really know the general public what it does.
ACL stands for anterior cruciate ligament, which is one of the 2 ligaments right in the middle of the knee that cross one another, hence cruciate. It's really a key stabilizing ligament. It's like a rope that attaches the 2 bones together, the femur and the tibia. And it's a commonly injured ligament in sports injuries. Usually it's a twisting or jumping injury. You land funny, twist the knee, and it tears. People usually hear a pop or they feel a tearing sensation, and then it hurts right away. It swells up right away. You know something's wrong. You can usually make the diagnosis just examining the patient. You feel the instability. You can feel the tibia bone moving abnormally relative to the femur bone, but then we get an MRI to confirm it. So the problem with the ACL is it doesn't heal. Some ligaments in the body, if you tear them, they can actually scar down and heal, but the ACL, because it's within the joint itself, does not heal. And it's a critical ligament for stability. Without it, it's really hard to do sports with jumping, pivoting, and twisting. In the old days, they would call it a trick knee. That was an ACL tear, a knee that just buckles whenever you try to land on it, and you're not quite prepared for that. So most athletes, the vast majority of athletes who tear their ACL undergo surgery to reconstruct it, and that is an arthroscopic procedure.
Wow, I just learned something new. I never knew those ligaments crossed. Wow.
Yeah.
That is fantastic. Dr. Saperstein, hold that thought. We're going to take a quick break, and on the other side, I want to ask you a little bit about Tommy John surgery, bicep repair, and of course, being the team physician at FAU and all the success you've had there and that the team's having now on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We're back with Dr. Alan Saperstein, orthopedic surgeon and sports medicine specialist on staff at Boca Regional Hospital, and also a team physician with the FAUL's sports. Dr. Saperstein, I wanted to ask you about tennis elbow. We're in the tennis paradise right here, it seems like, in South Florida. You see a lot of that?
Sure, absolutely. Certainly we have a lot of retirees in this community, and so many of them are playing tennis. Tennis elbow is an overuse injury. It's just a degradation of one of the groups of tendons on the side of the elbow, and it is just so frequent in that population. I probably see 2 or 3 new cases of it every day. Generally, the treatment is conservative. The most important thing is resting the elbow. But there are some things that can be adjuncts to help it get better a little faster. We not infrequently do injections. Sometimes a cortisone injection or 2 can be helpful. Sometimes anti-inflammatory medications. Ice can be helpful. And then there are some newer things that we're doing for refractory cases. So when we get a case that just isn't, after 6 months of resting and injecting and medication, and they're not really turning the corner and not able to get back to play, there are 2 new procedures that are out there. One is PRP, which I think has gotten a lot of press lately, which is platelet-rich plasma, which basically we take a little sample of blood from the patient, spin it down, and get some of the repair cells and chemicals, and then inject that back into the diseased tendon. And that's been promising in terms of helping to resolve symptoms. And then the other newer procedure is a type of surgery, but it's a minimally invasive surgery that's done under ultrasound guidance, where we basically stick a tiny little probe into the diseased part of the tendon, of the tennis elbow tendon, and we're able to kind of ablate we use ultrasound energy to ablate some of the diseased tendon and suck it out of there. And it's been surprisingly successful in helping alleviate that pain from tennis elbow. So.
Thanks for sharing the ultrasound one. I had never heard of that. I had heard of platelet-rich plasma injections, PRP.
Yeah.
But that's really neat with the ultrasound, too, how you're able to ablate. Baseball just ended. We have the World Series champions here in Palm Beach County now for spring training, the Houston Astros. It seems like every year on ESPN, so-and-so has to have Tommy John surgery. What is Tommy John surgery?
So Tommy John surgery, and I'm a Yankee fan. I love Tommy John, but I feel
that's
bad.
Right. He pitched for the Yankees.
I'm not quite sure how. Well, I know why it got named after him. He was the first patient, but usually we name the procedures after the surgeons who do them, not after the patient. But regardless, Tommy John surgery is done for an injury to the ulnar collateral ligament, which is one of the ligaments on the side of the elbow, on the inner side of the elbow. And it's really a ligament that's only injured in people who abuse their elbows, and typically that's throwers. Pitchers in particular, the pitching motion just puts an incredible amount of stress on the inner side of the elbow, and basically that ulnar collateral ligament wears down and tears. It either stretches out or tears, and when that happens, you really cannot continue to pitch. So basically it's a reconstruction of that ligament using some tissue from another part of the body. Typically, it's taken from one of the forearm tendons, but it could be taken from a hamstring tendon or potentially even a cadaver tendon, but it's basically rebuilding that tendon. It's not an operation that the vast majority of the population would undergo. If you're not a baseball player at a very aggressive, competitive level, it's unlikely you would need that. Maybe occasionally in a tennis player or perhaps a quarterback, but other than throwers, it's really not a common thing.
Yeah, it's for someone who's throwing a lot. Now let's stay in that area because I think it's fascinating that because I always think of orthopedic surgeons for knee and shoulder, but you work on the biceps as well. And another thing that can happen to anyone, even someone working out at the gym, is a bicep tear, and sometimes that needs to be repaired surgically. So do you do bicep repairs, and if so, how do you complete them?
Sure. So the biceps, everybody knows the biceps muscle. It's the Popeye muscle. Typically, when there are 2 ends to the biceps muscle, and it could tear on either end. The one that we usually repair is when it tears at the elbow. When it tears at the elbow, usually it's doing some type of lifting. It's very common in weightlifters. If they weightlift just a little bit too much, or if it's a sudden, or in someone who's not lifting weights, has a sudden force up up against their elbow as they're flexing it, it can pop that tendon. We do repair that. It's not arthroscopic, although I'm sure somewhere somebody's experimenting with a way of repairing that arthroscopically, but I would say for 99.9% of orthopedic surgeons today, it's not an arthroscopic repair. But it is an injury that can be repaired, and the results have been excellent. Again, it's a surgery that has changed over the course of the years. When I trained, again, 25 years ago, it was a 2-incision approach. We would approach the tendon and retrieve it in the front of the elbow, and then thread it to the back of the elbow where it normally inserts and repair it to the bone there. We have newer techniques now where we can do it through 1 incision in a safer manner with less risk of injury to arteries and nerves. So now it's done through a 1 incision approach using some sort of more advanced fixation techniques that allow us to put it down to the bone and let it stay there and heal well.
That's amazing. I mean, until I had you on, I had no idea that orthopedic surgeons treat the elbow, the biceps, I mean, the whole body. That is amazing. I want to get into the FAU stuff because I want to save a little time for that. But one more, joint replacement surgery. That's something that's always in the news now too. That's something. It's like another key word that we always see. You talked a little bit about knee joint replacement. Are there any other kind of joint replacements that you can help someone enjoy a better quality of life with?
Yeah, sure. Joint replacement surgery is generally done for arthritis, for wear and tear to joint surfaces. And that's usually accompanied by pain and loss of mobility. And usually it's something that starts to occur later in life, from middle-aged and on. So most of our joint replacement patients are 50 and up. Initially it was the hip, then it spread to the knee, then the shoulder, the ankle. Again, it's a situation where really you could replace potentially almost any joint in the body, but most commonly it's knee, hip, and shoulder. It is not an arthroscopic procedure. Those are procedures that do require an open approach. They're constantly evolving in terms of the materials that we use to resurface the joints, in terms of the techniques we use. Recently, I started using robotics for joint replacement in the knee, starting with partial knee replacements performed robotically, and now total knee replacements performed robotically. It's really something that, every year there are nuances and changes. And when I look back at how we do a joint replacement now versus how we did it 20 years ago, it didn't change overnight, but gradually it morphed into very different type of operations.
Yeah, medicine is evolving at a rapid speed. I mean, it is amazing. Just from doing the show in the last year, I've seen some outstanding movement in medicine. Finally, I wanted to ask you this the whole time. You're one of the team physicians on the FAU football staff and for FAU sports. Which sports do you cover?
So I've been with FAU for 7 years now, and I've had an opportunity to cover all sports. Obviously, football's always been a highlight, and especially this year after going the first 6 seasons having at best a 6-6 record, it's great to have a real fantastic blowout kind of year, and God, I hope it continues and we have success in the rest of the season and in conference championship and bowl game to come. So, but it's really been wonderful. But yeah, it's not just football that I take care of. It's certainly taking care of women's and men's soccer and women's and men's basketball and softball and volleyball and really, they're really a great group of athletes, student athletes at FAU. I've seen a lot of these kids go from freshmen to seniors, and some stay on as grad students. And it's really been nice to work with some of the same kids for over the course of 5 years, because you hate to see the same kid get injured a second or third time during their college years, but it's nice to see them evolve and then move out into the world, and it's really a special place to work.
Well, it's a great program too. Lane Kiffin, let's talk a little bit about football because that's the sport and season we're in right now. But Lane Kiffin's really got them playing. They've won 6 in a row. They're 7-3. Like Amazing. You said, it's the best record they've had in the last 6 years. And they're talking bowl games in Boca Raton. Who would have thought? I've heard the Boca Raton Bowl, of course. I've heard the Bahamas Bowl, and I've even heard the Zaxby's Bowl in Dallas, Texas. So I think the best bet would be Zaxby's if the record, if they really run the table. And man, you'd get to go to Dallas, Texas, and that great stadium out there. That'd be unbelievable.
Just be awesome to be with such a great team and to just see success after a long dry spell. It's really nice to see them having so much great
And on your
success.
website, I believe I saw you in a picture of Coach Howard Schnellenberger back in the day at Michigan State.
Sure, that was my first season with the team was his last season with the team, and I think that was my first road game at Michigan State.
Wow,
so that was a lot of fun.
That must have been neat to see. And your colleague is a team physician too, right?
Dr. Bergman and my other partner, Dr. Lloyd, are both with FAU Athletics as well.
Oh, that's great. What is the most peculiar injury you've seen out there in college sports? Doesn't have to be football, but is there something that just kind of...
I'll tell you my most interesting experience was actually on that trip? Michigan State trip. Unbeknownst to me, on the plane ride home, one of the support staff, an older gentleman in the support staff, had a recent hip replacement surgery, and which was unbeknownst to me. But I'm halfway through the flight. I'm reading a book, and I go, Doc, you got to come to the back of the plane. And this gentleman apparently got up out of his seat and dislocated his hip replacement. So at 30,000 feet, I had to reduce the hip replacement back into place on an airplane, which was definitely a unique experience. So that was FAU Athletics provided a very interesting experience for me that day.
It's great to have a doctor on the plane with the team as well. Doctor, you've been great. Thank you so much. I just want to give out your info one more time. Boca Ortho and Sports. Dr. Alan Saperstein, his office is 1905 Clintmore Road, Suite 214, right here in Boca Raton, 561-241-8668, and BocaOrthoandSports.com. Dr. Saperstein, thank you so much. I hope you come back on the program in the future.
I would love to. Thank you for having me.
Thank you, and good night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program